It's very important for you to realize how important it is to look at someone standing and lying down before you start to work. I'm going to demonstrate doing an assessment on someone. Next we'll have a look at the malleolus and see if they're level. Then we'll check the tibial tuberosities and see if they're level. In this case the left is actually lower than the right. Next we'll check the top of the leg bones, the greater trochanters. Next we'll check the ASISs. Then we'll check the crest of the ilium. In this case the left's low. Then we'll move up to the shoulders, check at the acromion process, in this case right's low. Then we'll go up and check the holes in the ears, the auditory meatus. Now we'll have a posterior view. In this case left's low. Notice in this case with the left PSIS being low that the spine heads off to the left and then curves back over to the right to compensate. It ends up bringing the right shoulder low as well, and the right temporal bone goes low, compensating for the left low ilium. Next we'll assess the lateral view. First thing that I notice is that the ASIS is considerably lower than the PSIS on both sides. I also notice that his knees are locked back. He's compensating for the flexed pelvis. The next thing I notice is that his ear is in front of his shoulder and his pelvis is projected forward. In correct posture, we'll see the ear hole directly over the shoulder directly over the leg bone directly over the knee directly over the malleolus. Pause the video in just a moment and have a close look at the assessment and see if you can figure out what's going on with this person. This chart has shown me exactly which bones are in the wrong place, so I know which muscles are tight or short and pulling these bones in this position. I will draw on the chart some of the muscles that would be causing this distortion. Were you able to figure the assessment out? If not, don't worry, you're in good company. These classes will teach you to know what to work on before the person even lays down on your table. When I'm doing an assessment, I always use green to mark the bones, red to mark the muscles, and purple to mark the pain areas. That way at one glance, when I'm working on someone, I can see and keep straight what the various lines mean. A previous x-ray showed that this person did have a true anatomical leg length difference. He now wears a pair of shoes with a 17 millimeter lift in the sole of the shoe. Palpation shows that the PSISs are perfectly level. Notice the big change in the scoliotic pattern that he showed before. The crest of the ilium, which we don't rely on much for measurement, is level, and the top of the leg bones are perfectly level. We still see the right shoulder a bit low, not nearly as low as it was. Unlike many of the patterns that disappeared when he got the lift in his shoe, we still need to work on the right pec minor, the left levator scapula, and the left trap. The temporal bones have corrected themselves now that the iliums are level as well. The tibial tuberosities are level now. The crest is level now. The top of the leg bone is level. The ASISs are level. And the shoulder is still a little low on the right, of course. You will learn to understand and apply these techniques, and you will actually change the destiny of these people who are suffering at the moment. Just imagine what that will do for your practice. The workshop will equip you to supply far superior treatments to your patients while saving your hands and extending your career. People will always need to get out of pain and be willing to pay for it, unlike pampering massage, making your practice indispensable. I know that purchasing this class will add significant value to your practice. Thank you for visiting the Career Extenders website.